name is Dr. Mia Crupper. I'm a naturopathic physician, massage therapist, and midwife at the 2BWell clinic. As a specialist, I'm more of a primary care provider. I've spent the last 2 decades focusing in reproductive health as well as dermatology and aesthetic medicine. My personal philosophy in how I treat patients is doctor as teacher. I really want to come from a place of shared knowledge. I have expertise in what I'm providing, and I don't want to come as a dictator. I want to come as a partner. We're a team that works together to uncover what the cause of the symptoms are and hopefully find a resolution of them. As a massage therapist for just over a quarter of a century, focusing in pain management, musculoskeletal health is a big part of my clinical practice. The experience for pain management or musculoskeletal complaints for patients includes soft tissue techniques, for example, actual hands-on massage or strain counter strain, or a technique called pin and stretch, what helps to change the muscular response to the body. In addition to that, the osteopathic or naturopathic manipulation technique is a physical movement gently of the bones to help them be back into alignment. That can also be accomplished with an activator, which is a mechanical tool that actually gives a small impulse to either help the muscles relax or potentially help the bones themselves move back into place. In regards to the PIT therapy or the PIT treatment, that's a small injection. We sort of follow the pathway of discomfort up the body to help alleviate where that nerve involvement may be coming from, and to help the nerve sort of re-communicate with the brain so that it's relieving of the pain that the patient is experiencing. It can have a pretty significant and pretty immediate pain relieving pattern. With reproductive health, I tend to focus a lot in starting with botanicals, nutraceuticals, diet and lifestyle if possible, and then if necessary move into pharmacological agents. For example, someone who is dealing with perimenopause or menopause, we can accomplish a lot through natural therapies, but sometimes a little bit of bioidentical or hormone replacement therapy can be really enhancing to the patient's quality of life. Services I provide for dermatology include lifestyle and nutrition, and botanicals and nutraceuticals. In addition to that, I can do a lot of minor surgery techniques in aesthetic medicine. And then for aesthetic medicine, I focus in neurotoxins and fillers, which help to alleviate some of the fine lines that patients start to have as we've spent decades on the earth using our muscles and smiling and frowning and all sorts of expressions. The ways that naturopathic medicine can improve a patient's life is to help them understand what's going on with their body, why they're having the discomforts, so that patients are able to restore and regenerate and improve their symptom pictures. In relationship to the minor surgery, dermatology, or aesthetic techniques, it, in my experience, is a really great sounding board. If somebody is feeling distressed because of how they feel they look on the outside, alleviating that distress often inspires them to heal the inside as well, and then they achieve their optimal health because they're motivated and inspired to do so. So my parting words to future patients is that I'm extremely excited to potentially be a part of your team and helping you to achieve your health. We've got a wonderful group at 2BWell, and joining the ranks of these amazing practitioners is something that is extremely meaningful to me, and I'm grateful to be a part of both 2BWell and of your future health.